Hello everyone, in this particular video we are going to discuss about infections. This is just an introduction video for infections. In later videos we will discuss about each infection in detail. So infection diseases or illnesses which are caused by pathogens. What are pathogens? Pathogens are the disease causing microorganisms. So firstly the pathogens or disease causing microorganisms, they enter the body, they invade the body, then they multiply, and they get interfered with the normal physiological functions, and they disrupt the normal physiological functions. That's how the mechanism of the pathogens infections occur. So they remain, that is, the infections remain as a global health challenge, like, because many of the times the infections can be pandemic like corona. So in that times it is a global health challenge, because these infections, they can spread rapidly, they can evolve rapidly, they can produce new strands rapidly, and cause outbreaks. So understanding the mechanisms of infections transmission and prevention is essential for effective public health management. There are some key definitions we have to know about infections. Like, what is a disease? Disease is a condition in which normal body functions will be disrupted, which leads to the symptoms and signs appearance. So, what is the infection? Infection is nothing but the entry, establishment, and multiplication of pathogen in the host. The entry, establishment, and multiplication of pathogen in the host, in the host cell, in the host body, is called infection. So pathogen is nothing but a disease causing microorganism like bacteria, fungi, etc. Virulence is nothing but the degree of pathogenicity or the ability of microorganisms to cause a severe disease. Like, see how extent um, a particular strain or particular pathogen can cause a disease can be said as virulence, the degree of pathogenicity, right? If a strain has high virulence, then it is more harmful to, it is a more harmful infection. Infectious agents are generally pathogens or disease, viruses, bacteria, fungi, parasites, prions, etc. Like bacteria, certain bacteria like Mycobacterium tuberculosis, E. coli, viruses like influenza virus, HIV, SARS-CoV-2, fungi like Candida albicans, Aspergillus species, parasites like Protozoa, helminths, ectoparasites, prions like many things. They misfold proteins, cause neurogenerative degenerative diseases, right? They cause neurodegenerative diseases. Transmission of infections diseases occurs by direct contact, like touching, kissing, sexual contact, or indirect contact, contaminated surfaces, fomites, or by droplet transmission. When a person, like when an infected person coughs, sneezes, then this droplet transmission, airborne transmissions will be almost similar. Like when a person coughs or sneezes, then the pathogens will be in the air, suspended, and then when healthy person inhales them, then the healthy person gets that infection, because these infections can be very harmful for the people, like, they can be transmitted very rapidly and easily. Vector-borne diseases like mosquitoes and ticks, which can be seen in in areas where there is low hygiene conditions. All foodborne and waterborne diseases also can be seen. Vertical transmission can occur where when the mother have the pathogen in her body, then the child may get the pathogen. Phases of infections or incubation period, prodromal phase, acute phase, decline phase, and recovery phase. Where in incubation period, there is an entry of the pathogen. From the entry of the pathogen till the appearance of the first symptom occurs, the time period between these two things is called as incubation period. Prodromal period is a is a phase where there is a early, that means there is a mild symptom appearance, but no specific symptoms will be appearing. There is a something mild, and that is an onset of some diseases. After that, in acute phase, there are most severe symptoms can appear, and pathogen is will be actively multiplying in the body. Active multiplication of the pathogen can be seen. After that, there is a decline phase where immunity rises, immune responses will occur. Treatment, we may produce treatment, we may give treatment and reduce the pathogen content in the host organism, and thereby the symptoms will be improved. After decline phase, we have a recovery phase. In recovery phase, the body recovers itself, but the body will be more prone to the infections. Classification of infection diseases can be based on different categories like duration, occurrence, type of pathogen, and mode of transmission. Like based on duration, the infectious disease can be acute, chronic, latent. Where in acute, the infection will be rapid and it will be only for the certain period. It is a short duration. After that, the infection can be chronic, where the infection is for a long time. In case of HIV and TB, latent periods are dormant periods with the possible reactivation of the pathogen in the future. Based on occurrence, the infections can be endemic, epidemic, pandemic, sporadic. Where endemic means this constantly present in a particular area. After that, epidemic means there is a sudden increase in the cases, sudden increase in the infection. Pandemic means where the pathogen affects all over the world. Sporadic means occasional cases. So based on type of pathogen, the infections can be bacterial infections, viral infections, fungal infections, prion diseases, and parasitic infections, etc. So mode of transmission of based on mode of transmission, the infectious diseases can be airborne or vector borne, where the transmitter will be a vector like mosquito, food borne like through contaminated food, water borne contaminated water, or through direct contact. The common symptoms of infectious diseases are fever, fatigue, malaise, cough, sore throat, diarrhea, vomiting, skin rashes, lesions, muscle aches, headaches, swelling of lymph nodes, localized pain or inflammation, discharge from nasal, all the all the roots of the body, and several infections may cause sepsis, organ failure, or even shock. All these are infections symptoms, because infections are the more easily spreadable diseases, and they are contagious. So that's all for this video. We will discuss about every infectious diseases in the later videos. Thank you.